Hi there, give me just 1 second to upload my screen here. Let's go back, here we go. Okay, welcome. My presentation focuses on the debate surrounding midwifery care and birth centers in California. We'll explore different perspectives, legal aspects, and challenges along with insight from interviews. The goal is to provide a balanced view on this ongoing discussion and consider potential solutions for improving maternal care access and safety. So why we're going to discuss why this issue matters in California, the rise in demand for midwifery-led birth, and the different perspectives on safety, access, and collaboration. In California, more families are turning to midwifery and freestanding birth centers for childbirth. However, perspectives on shifts vary, with concerns about safety, hospital collaboration, and policy barriers. This presentation will explore these competing viewpoints and the implications for maternal and newborn health. California has made some major regulatory changes, such as the passing of SB 1237, which removed physician supervision for CNMs. However, midwives and birth centers still face legal and financial hurdles, including Medi-Cal reimbursement issues. These regulations impact how midwifery care is delivered and accessed, including birth choices and healthcare equity. So we'll take the perspective of the midwives. Midwives have autonomy and accessibility. They also face challenges with hospital collaboration, insurance and reimbursement. Midwives emphasize, as I mentioned, autonomy and the importance of expanding birth centers. However, they face obstacles such as hospital pushback and insurance limitations. Many advocates for policy changes to improve midwifery care integration emphasize a role in providing safe, cost-effective, and personalized care. Now we will discuss the hospital perspective. Many hospital providers are concerned about the safety of out-of-hospital births, especially in emergency situations. Liability and inconsistent transfer protocols make collaboration between hospital and midwives challenging. Hospital-based providers often advocate for more oversight and structured partnership to ensure better continuity of care. And then we'll take the perspective of families. Families who choose midwifery care often value autonomy and a personalized birthing experience. However, they sometimes struggle with the insurance barriers and navigating hospital relationships if a transfer is needed. Many families report positive experience with midwifery-led care, but express frustration with the systemic barriers to access. Now, policymakers. For policymakers, they must balance the expanding access to midwifery care with ensuring safety standards. Laws like the SB 1237 were designed to improve access, but ongoing debates continue about how best to integrate midwives into the healthcare system. Some legislators are considering new policies to address the gaps in insurance coverage and emergency transfer protocols. And here is a comparing perspective. As we mentioned before, the midwives have more autonomy, but they also have difficulty sometimes with reimbursement and hospital collaboration. Hospitals are believed to be safer, have less liability, and better prepare for emergency protocol. But for families, it's important to have choices, insurance reimbursement, and a good collaborative relationship with the hospital. This table summarizes the viewpoints. While all stakeholders want safe birth outcomes, their concerns and priorities differ, making collaboration challenging but essential. Identifying areas of common ground could help create a more cohesive maternal healthcare system. And our last one. After researching this topic and conducting interviews, it is clear that better collaboration and clearer policies could benefit everyone involved. Midwifery and birth centers offer valuable options for many families, but the challenges remain in ensuring seamless care. Recognizing midwives as a key part of maternal health care, improving communication between providers could lead to better outcomes for birthing people and newborns. And some summary points. In conclusion, midwifery and birth centers play an important role in California's maternal health care system, but regulatory and practical challenges remain. While different perspectives exist, there is a potential for greater collaboration and policy refinement to improve maternal and neonatal health. Thank you for listening. And here are my references. Thank you.